Ask her for
Ask
permission.
permission, right? And explain to them what we're going to do, all right? And if we're in a sensitive area, we're going to explain what we want them to do or why we're going there and how we're going there, okay? And if they have a problem with that, what do we do?
Stop.
You what?
Stop palpating.
You stop, but you can use their hand. You ask them if you could use their hand as the palpating hand under yours.
Okay.
Okay. Then once they start getting familiar with you, and you build up, for my other class, rapport, which is a trust between you and the patient. They will allow you to do more. Okay. So that's why don't be so excited that if they say, "I don't want you to touch me there or wherever," all right? Because as I said, we have 400 points. Use something else in the beginning. And then you let them know that, it's going to take us a little longer to get you to resolve your problem. I need to use certain points. Is that okay? All right? So hopefully then they say, yeah, okay. By that time, they know you're not going to do anything adverse to them and so forth and so on. All right? So I specifically got it there because I want to show you how we drape her. It's no special deal. You're just basically putting a towel or something on top of them in their strategic spots over here, okay? And if you have a busty woman, okay, as they say, they have jugs, I don't know. Anyhow, then you ask them to distract it to the side while you palpate. Okay? All right. So we have her permission. We've explained everything to her. Now what we want to do is I'll start from the head and we'll work back, okay? I will show you the sutures. As far as the bones, we went over them, okay, of the head. You can do that on your own amongst yourselves, okay? Now, another thing which I didn't say, tonight's your night that you want to pick your partner for the practical, right? Okay? Because you need someone to be your guinea pig, all right? And vice versa, then you're going to use the other one. So you have time tonight and in between, if you can meet up with them, to practice, so you know the lay of the land. Makes it easier for you, right? Okay. The other thing is, though, and as I said in the beginning, don't think that you're going to divvy up who remembers what. Okay? Oh, I'll take the I'll take the head. You could take the sternum. I'll take the neck. No. You better know it. All right? I think I'm more than fair because what I'll do is you're going to have papers out there with questions. Now, I'm not sure if I'm going to have a page for each one of you with questions and you just pick which one you want. Or I'm just going to have like 4 or 5 questions in each segment and you pick one and you can't have the other one doing anything similar to that. I haven't decided that. That's last minute decision. All right? So we understand, all right? Okay, so let's start with the head we did already, the face we did. I'm not going to point out anything. We did also, I went over the muscles. You have to pick out the muscles. You've got to practice on the muscles. Well, let's do some of the markings of like the neck, all right? So the marking of the neck. The first one is up here, swallow. Ah, there it is. What bone is that? What level vertebra is that?
C3.
C3. Then gently, just below it, you should feel a little nub for the women. For the men, you have the Adam's apple. You really feel it. Okay, that's what is that? What is that underneath the hyoid bone? What's it? Thyroid cartilage.
What?
You're thinking too hard. Relax.
Yeah, that's why I'm like, what?
Thinking too hard. That's thyroid cartilage, and that's from when to where? From where to where?
C4 No, C4 and 5.
C4 and 5. That's right, C4 and 5. Then below that, you feel the cricoid cartilage, which is C6. And it's just a cartilaginous ring. It's the only one that's a whole ring, okay? The rest are all have breaks in it, okay? All right. So then we come down this way, and that's what?
Jugular notch.
The jugular notch. On either side of the jugular notch is what?
The angle of the clavicle.
No,
No,
on either side
on
of
the
the
side.
jugular notch. What is that? Sternoclavicular joint, which is a gliding synovial joint, which is also the only joint that attaches the whole upper extremity to the thoracic cage. The only synovial, true synovial joint. Okay? All right. So then, below it is what? May I just take one
Yeah,
button?
okay.
I'm not.
Manubrium.
Yeah, the manubrium. You do it. The manubrium, and that's the manubrium goes to what area? Ooh, this is good.
Angle of sternum.
The angle, the sternal angle, or manubriosternal joint, or angle of Lewis. Okay, and what's lateral to it?
Second.
The second rib. So the intercostal space above would be what? Intercostal space below would be, you got it, all right? And then you count all the way down. And when you do your counting, you count close to the sternum, okay? So now right after that, and usually this runs about an inch and a half to 2 inches. Then you come down here, and this is the body, and that's from 5 to 9. In old books, they called it the gladiolus. Don't ask me why. All right, but I'm old, so I know all the old books. All right, so then right underneath it is your xiphoid process, which is T10. Okay? All right, so now that's that. Now we did the neck. Let's do the triangles while we're up at the top here. All right, so the first triangle is the anterior cervical triangle. The anterior or front line is your median line. Your superior line is your inferior manubrial border. And then your posterior or lateral line is your anterior SCM. Okay? So you have 2 of them on either side, right? And what's in there?
Cheek.
What is it? Come on.
Common
artery, hypoglossal nerve, and interjugular.
Very good.
vein.
Excellent.
Internal.
Excuse me. Now, if we go like this slightly, let me all right, just like that for a second. Here's your 2 bellies of the SCM. This is your sternal belly. This is your clavicular belly. This is called what? Supraclavicular fossa. I know it's so. Think about it. All right, think about. Let's dissect the word. Lesser means smaller. Supra means above the clavicle. Supraclavicular. All right, so just dissect the word. Most of these words you can get. All right, and she's got a nice greater supraclavicular fossa right in there. Okay, right in there. Oh, and what is this? What is this, people?
External jugular vein.
External jugular vein. Look, really nice. Okay, so I get excited. I'm very bad. Anyhow, thank you. So if we go like this, this is what muscle? Trapezius muscle. The upper belly of the trapezius, right? This is what? Clavicle. And then posterior SCM. Okay? So, what's in there?
Brachial
Face.
plexus, accessory nerve, subclavicular artery, and then
Right. And external jugular, which I just showed you. Okay? So now, in here also there's a floor of 2 muscles. There's one up here. Which one is that?
I forgot.
Starts with an S.
I can't say that.
Splenius capitis.
Yeah,
And then the one below, right here, would be your levator scapular.
Oh.
Okay? All right. Then you have another triangle. What's that one called? Oh, omohyoid. Oh, remember it now. All right? So the border here is your omohyoid, SEM, and your clavicle. In here, if we press down deep enough, we could feel the pulsations of the subclavian artery. Okay? All right. All right, so that's good. So we got all of that. All right. All right, let's do the respiratory muscles in the front, because there's one in the back. Which ones are in the back?
Say the word out loud.
Serratus.
Oh, posterior and superior.
Superior and inferior. Serratus, posterior, superior, and inferior. Okay? Okay? All right. We'll get to that later. All right? But the other ones are the major one, which does the actual inhalation, exhalation. Which is that?
Diaphragm.
Diaphragm. What is the nerve that goes to it? Phrenic.
Oh,
Phrenic nerve, which is C3, C4, C5 nerve roots. Okay? Coming off of the thing. All right? So, that's what happens when you get a hangman's fracture. A hangman goes right into it just below C2. So they can't breathe anymore. Okay? All right? Now, we don't want to do that. We don't want to do that. Anyhow, okay, so then we go to intercostals. You have the internal intercostals and the external intercostals. The internal intercostals do what?
exhalation.
Exhalation. External intercostals do what? Inhalation. So inhalation is accommodated by elevation, and exhalation would be depression. Okay? All right. So if I ask you in the palpation, you're going to come put your hands in between the intercostal spaces, and you're going to ask the patient to exhale and inhale, and you're going to tell me which one is happening at with what muscle. Okay?
Got it.
Basically. All right. So that's that. All right, so let's do so that's basically, other than the serratus anterior, serratus posterior, superior, and inferior, that's basically all that we need to know for respiratory muscles, okay? There are other ancillary muscles like the scalenus muscles, which I forgot to tell you about in here. Let's go back to this. All right, the scalenus muscles, all right? What scalenus muscle is right underneath the omohyoid muscle? Think about it. There's 3 scalenus muscles. Posterior, medial, and anterior. Da 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 da. Anterior, it's the closest to the front. So anterior scalenus is here, and it'll be right underneath the omohyoid muscle. The next one on the other side of the omohyoid is the medial. Okay, and then behind that is smaller is the posterior. The posterior attaches to the second rib, the medial and anterior attach to the first rib. So they basically help with inhalation, but they're like ancillary. They're not true respiratory muscles, okay? All right, so let's go to the abdominal muscles now. All right, so we have the uppermost or most superficial muscle is your external oblique, all right? Now, how do we find the external oblique? Right, to the opposite side. So I want you to bring this shoulder to this hip, not all the way, all right? And you put your hand over here. Okay, now go ahead and do it. No, do it this way.
This way.
No, not this, the shoulder. No. All right, she's doing it. No, I asked her to do this side. Go this way. Like that. All right, so that would tell me, I would feel the contraction, and on this side would be, this side is the external. Or this one here would be the same, or the internal. Okay. All right, you'll feel it. You'll feel the contraction on the other side. All right. Then underneath that is your rectus abdominis, and all we have to do is you place your hand here, make sure it's low enough. Just elevate your head, because that's part, and you'll feel the contraction. You don't have to have a full flexion, all right? Transversus abdominis is the one that just helps to evacuate any abdominal contents, okay? So when you're vomiting and heaving, that's one of the muscles that's really helping do that. Okay, so now, I think that's it here. Let's turn, now it's the man's chance.
Me?
Yeah. All right, come on.